Thank you, Mary. And good morning to everyone. And again, welcome you to our webinar today. We're very excited to be here with you. And if you happen to have the opportunity to have joined us in the past, welcome back. If you're new to us presenting, happy that you've joined us. And so just a couple things that we want to kind of just talk through before we get started. So I want to take a moment just to share that the material presented today is to be used for educational purposes only. This material is intended to assist peer professionals as they strive to improve the quality of their documentation. This information must be understood as a tool for improving documentation rather than an exhaustive statement of an employer's legal obligations, which are defined by statute, regulations, and standards. So we ask that you just please consult your state guidance documents and state oversight agencies for specific documentation requirements. We are going to talk through a number of documentation requirements, but we're going to talk from a general perspective. So we just like to give that disclaimer so folks know that they still have to adhere to whatever their state identifies as requirements for documentation within their state. So again, Maria and I are happy to be here with you today, and we're going to provide just a brief introduction of who we are and our expertise, so you know a little bit about us. So again, I'm Yvette Kelly with NYU's McSilver Institute. I'm a licensed mental health counselor in New York State and have been for the last 20 years. And I've spent my career working with marginalized and underserved communities, particularly with children and families. Throughout my career, I've held various roles to include clinician, clinical supervisor, clinical director. And as the clinical director, I provided oversight of a behavioral health clinic, where in that role, I became versed in documentation requirements for delivering Medicaid billable services. And then over the years, I've just continued to improve my understanding of the behavioral health documentation requirements. So that's a little bit about me. I'm going to turn it over to my colleague, Maria, just to give a brief introduction of herself.
Thank you, Yvette. Good morning, everybody. I am Maria Fuentes. I am a family peer advocate since 2019. I have worked with families since 2018. I've been a family advocate for a while. So my focus is on working in communities and working with families, and documentation was part of the program that I was in, so I had to learn it in the hard way sometimes. So I love adding on to my knowledge as well. I'm glad all of you are here, and yep, I'll turn it back over to Yvette.
Thank you, Maria. And just to say that Maria and I have worked diligently in New York State to develop a number of resources that are available for peers around how to complete documentation. Of course, it is New York specific, but I think it's general enough that folks on the call could probably benefit from it if you have not had the opportunity to access it. I think we will have some information at the end to do that. We've gotten some feedback that it's peers have found it very valuable. So we'll offer that up to you as well. So we continue to kind of refine our skills around this. So here are the topics we're going to cover during today's presentation. So we're going to start off by detailing what collaborative documentation is, and then we'll move on to discussing the core values of peer support and how collaborative documentation strengthens these values. We will then discuss collaborative documentation as a practice. So what does it actually mean when you're doing it in practice, as well as review some strategies to strengthen this practice along the way. We will devote some time at the end for Q&A. However, we do encourage you to please feel free to submit your questions throughout today's presentation, and Maria and myself will do our best to answer them. We do prefer more of an interactive style of presentation, so it's always helpful if you have a question on a slide or content that I'm presenting at the time for you to either unmute, raise your hand, chat in the question so we can address it there. We'll try to do that and be mindful of time as well. So just wanted to say that. Here are our learning objectives for our time together. So by the time you're done with today's presentation, we hope that you are able to at least define the core principles of peer support values and how collaborative documentation aligns with these principles in practice, to identify practical strategies for implementing collaborative documentation effectively during peer support sessions with participants, to explain the benefits and recognize the potential challenges of using collaborative documentation for both peer providers and the individuals receiving services, and really to apply best practices to enhance communication, promote transparency, and support shared decision making through collaborative documentation in behavioral health care. So that's what we're hoping that this presentation brings today and that you walk away with. And again, hopefully that you have questions so we can clarify any of the content presented today. As we always do, we like to know who's joined us today, so we're going to ask that you just take a few minutes to complete poll question, which should pop up momentarily. And just let us know in what capacity you're joining the call today. It's always helpful for us as we tailor content, but also can speak to that particular role. So if you could take a moment to respond, that would be helpful. Thank you, guys. I see your responses coming in. Great. Okay, so we have a lot. Great. So peer support providers, peer supervisors, some directors and managers. And I see we have a category of people of noting other. If you could just chat in what the other is, that would be great. Just let us know what position you're joining us in. That would be fine. Okay. All right. Thank you guys for that. Let me just check the comments. I'm doing a lot here, so just bear with me in terms of that. Okay, so the recovery coach, support partner. Okay, excellent. Well, we're happy to have all of you on the call with us today. Okay. It seems like most folks who have joined us today are peer providers, which makes sense. That's the intent of the call today. So that's great. All right. We also do have one other poll question. We'd also like to hear from providers about what comes to mind when you hear collaborative documentation. So just answer this question. So when you hear the words collaborative documentation, what's the first thing that comes to mind? Okay. Thank you guys for participating in the polls. I see the responses coming in. Okay. So, so I'll give it a, looks like most say like it's a tool for accuracy and transparency. We'll talk a little bit about that. Also an opportunity to strengthen client relationships. Okay. I see no one has responded with one more thing to add to my workload yet, although that is a fair response. So feel free to put it there. And then a couple people just not sure yet. Here to find out. Excellent. Excellent. All right. Thank you. I think we can close that poll out. Sounds good. Okay. And we'll move on and we'll talk a little about that. I will say that in general, providers do have mixed, but often a positive view of collaborative documentation, especially as they gain experience with it and come to understand what it is and its intent and purpose. So hopefully you'll feel that at the end of today's presentation. So as peer support services continues to expand within the behavioral health realm, there are some additional considerations for how peer support documentation is written, as the documentation needs to meet the state's Medicaid program rules, right? And so whenever you move a service into what we would say a medical model, right? You have to be mindful of the expectations around documentation. If you are a peer provider in a program or that is more perhaps maybe privately funded or grant funded, the rules may be a little bit different. But as you move into billing Medicaid for peer support services, you do have to be mindful that there are some important requirements that you have to meet. And so, one of the biggest hurdles, I think, when it comes to peer providers and documentation is really just in our experience, has been translating the work done by a peer provider into statements that reflect medical necessity, active treatment, and represent the peer scope of practice, and of course is coded and billed correctly, right? And so if you happen to be on our previous presentation, we talked a little bit about medical necessity and what that means and how that's just a standard healthcare practice when you are billing for services. And so it's important that peer providers understand that as they come into the folds of providing services under the Medicaid program and kind of what the expectations are. And so I always say it's never about the peer doing the work or not doing the work. Generally, peers are doing the work, but the key into that is to be able to translate that into, again, medical necessity that reflects active treatment and represents, again, the peer's scope of practice. But one of the other challenges that not just peer providers experience, but the behavioral health sector in general experience is really the ensuring the timely completion of documentation. And in particular, it's all documentation, but in particular, it's usually around session notes, case notes, progress notes. I'll use all those interchangeably because they all mean the same thing. But when you're working with individuals and being able to capture what you did with that individual in a timely and cohesive fashion. And so collaborative documentation is really a practice that aims to support the timely, meaningful completion of documentation. And so as we walk through today's presentation, we'll talk more about how I'll call the art of collaborative documentation, doing that as a practice really supports the values of, being person-centered and being transparent. And so, and the benefits that comes from doing that. I think Maria will talk a little bit about that. But before we do that, just want to kind of level set and orient everyone to what is collaborative documentation, so that we're all on the same playing field when it comes to that. So know that collaborative documentation is really a shared approach that promotes best practices around participant engagement and shared understanding. All right, so that's kind of the intent of collaborative documentation. So it is a practice where the provider and the participant document together during sessions. All right. And so we're going to talk about that. But really what collaborative documentation is asking is for a provider to be open to having the participant contribute to the documentation in real time. So it is a continuum of practice, meaning one gradually phases in elements of the practice, and as the provider becomes more comfortable, you can expand its use. And when we talk about strategies, we'll talk a little bit more about that. I also want to step back for a minute and say this as well. And I said this in prior presentations, but the skill of documenting is something that is learned. It is not inherent. People don't know how to do this just because they've entered the realm of being a helping professional and they step into the doors day one. This is a skill that needs to be taught, it needs to be practiced, it needs to be refined, and it won't happen in a day's time, right? And so I say that because I just kind of want to manage expectations around this. Like you won't walk away today having, being an expert in doing collaborative documentation, but what you will walk away today with is understanding what it is, understanding the practice, understanding strategies that you can employ to kind of begin to adopt this practice, and then the reasons why and the benefits. So you'll get all of that in a package, but you will have to practice it as a skill which will get easier over time. Just to say that this practice does not replace the need for providers to hone their engagement skills, but when utilized together, can have a powerful impact on participant engagement and outcomes. All right. So, those same skills that you bring to the table, you're still going to need them and you're still going to use them. Um, I'm going to say just a quick note here about collaborative documentation and versus like concurrent documentation, because oftentimes those two terms are used synonymously. And so I just want to say, or they're used interchangeably. People will say, are you doing collaborative documentation? Are you doing concurrent documentation? But I just kind of want to highlight just one little kind of key piece in that. So really, collaborative documentation, as I said, speaks to the importance of partnering with the individual or family and soliciting their input, documenting their input, and then discussing that input with the individual or family throughout their care, right? It's not one time, it's throughout the entire time that you're working with them. Concurrent documentation really only speaks to the timeliness aspect of the practice, right? Concurrent, in the moment, real time, but doesn't really reflect the collaborative nature of the practice. And so oftentimes we like to say when we talk about collaborative documentation, it is assumed or assume that it is concurrent, but you could also say collaborative and concurrent documentation. So it's really kind of two, different side of the same coin. So just wanted to say that. So, for example, if I'm completing a note at the end of the session while the individual is in the room, but is not participating in the content, right? It definitely is concurrent, but it's not collaborative, and so it's important to have both of those things. So I'm just going to stop there to see if there's any questions before I move on. No? Okay. We'll keep powering through. And again, just a reminder, if you have any questions along the way about the content, please feel free to chat in or unmute yourself. So collaborative documentation is an approach that is efficient, is engaging, person-centered, it is goal-focused and compliant or adherent to, again, those Medicaid billable rules we were talking about. So it really does make it a valuable practice for both providers, participants, and the organizations to adopt. And so we'll talk again a little bit more about how you go about beginning to roll out working with individuals in this way, in this collaborative way, which will be foreign. I will say this, which will be foreign to a number of participants, because generally participants who have had time or have received services have not been used to engaging in this way. And so there's a little bit of psychoeducation that needs to happen for the participant for them to be actively engaged, which is what we'd be looking for. Um, so in terms of the collaborative documentation, the practice itself, again, it's completing notes during the session while the participant can see and hear what's being recorded. This helps ensure that the details are accurate, timely, and openly shared. And I always say this as just a rule when working with individuals and families is if you are working with folks, there should be nothing in their record that you can't say to them directly, right? Everything in their record should be things that you are able to share. And if you're not able to share them, you should assess whether or not they belong in the record. And so this kind of helps keep everyone on the same playing field in terms of, what's the work that you're doing, what's their perception and understanding of the work, what's your perception and understanding of the work. So that's important. Inviting participants to contribute directly to the note really strengthens their engagement and ensures that their goals, their concerns, and their progress are captured in their own words, right? So they're able to say, like, I think this is working well, or I appreciate it when you did this. That really made me think and gave me some additional insight into how I can, improve my own parenting skills. Like there's so many things that are helpful in inviting participants to contribute and collaborate on the note, that it definitely is worth a provider working to adopt this practice. And then co-developing plans and interventions in plain, mutually agreed upon language really builds clarity, ownership, and relevance. But I think, so we'll talk about the benefits for participants, but I'm going to just kind of go on the other side and just talk from the perspective of a provider. One of the things that we hear all the time is like providers are just, they feel that the paperwork is not really intended to be helpful or to be a tool in the work that they're doing with individuals, but just a mere burden. And so, by kind of shifting how you're doing the notes, you gain a couple things here, and one of them is that you gain the meaningfulness in the paperwork, right? The meaningfulness in kind of the journey to assist the individuals in meeting their goal. And so when you're, collaborating on, hey, like this is the goal that you're working on. Does that sound like what we talked about? And they say, yeah, it does. Or they say, no, you completely missed it. Or yeah, I meant it, but it needs to be, tailored here. Or, when you're talking about the progress they made, like, oh, looks, I can tell that you've made significant progress or you've made limited progress, or maybe we need to revisit this goal because progress is not being made. Like to be able to do that in a way that is collaborative with the participant, which is, let me say, which is what we always have expected, right? That's the expectation. We just haven't been good with kind of demonstrating that. And so this is a way to do that. Um, and so understanding that there's also transparency, right? So providers take time to explain what's being documented and really the purpose behind it. It's such a opportunity to enlighten and share with the participant kind of why are we documenting in this fashion? Why do we have to document it that way? Why is that important? And this is why. And so being able to do that. So really helping them understand, fostering their understanding and trust in the process, and also that they have eyes on their chart, right? They have eyes on the record. And so they're confident that how they are experiencing the services provided are reflected in the record, and that builds trust and engagement. So that's very important. And then, collaborative documentation is a process that adapts to each individual. If a participant is uncomfortable, right, then a provider needs to adjust their approach, right, while maintaining professional judgment and sensitivity to the participant's needs. There may be some folks as you begin to adopt and roll out this practice who need a little more time to accept this approach. But there are little incremental things that you can do to really prepare them or help them kind of be able to contribute to this process. And we'll talk a little bit about that. But all in all, I think it's just important to understand this as a practice and the intent behind it. And so why collaborative documentation? I just spent a couple slides just talking through it, but when I'm going to sum it up for you, just know that this approach helps align documentation with person-centered and recovery-oriented practices. And so when you do all of that, you improve the satisfaction not only for the participant, but for the provider, right? Fosters a more engaging, respectful, and transparent interaction between provider and participant. It also enhances efficiency by reducing the need for extensive post-session note writing, and minimizing follow-ups clarification. So again, the provider is going to get a benefit in this as well. And one of the major benefits here is just, when the session is done, the session is done. You don't have to spend another, even if it's just 10 minutes, 10, 20 minutes, 30 minutes after the session to document what you did in session. It's actually done when you and the individual's session is done. And so that there's some time savings there, but it also just helps with, work-life balance, which is what providers often talk about wanting to get to. And then the accuracy is improved by really documenting information in real time and ensuring that the details are fresh, clear, and reflective of the individual's own words and perspectives. And so, most of the time, I'll say this as just a little aside, when we're talking about timeliness and completing the record, I know I have been in a number of conversations about providers not completing the record in a timely fashion, and there being some dispute about care provided among the participant getting services and the clinician from my perspective, delivering the services. And so, just a couple of things I always like to point out in a world where more and more providers are utilizing electronic health records, that includes peer providers as well. Please note that all of the information that you put in there for notes are time and date stamped. If you happen to be doing this work as long as I've been doing this work, some of you on the call may have, there was a time where you um, wrote notes on paper, right? And then you kind of filed them in this big binder, right? There's a binder, it was a client, you wrote notes on paper. And so, no one would really know if I was, 2 weeks late in writing that note because there was no audit trail there. It was, I could write it on a piece of paper, I could file it in the right place and no one knew the better. Maybe if I signed it by the date. But these days, everything in the electronic health record is time and date stamped, right? And so I say that because if there's a dispute around care provided and people are reviewing the records to see if the appropriate care is provided, and you as a provider um, they see that you wrote the note 2 weeks late or 2 weeks later than when you provided the service, the question inevitably becomes, how do you know what you wrote was accurate? Because you are recording that 2 weeks later, right? And so I think all providers, all behavioral health providers, whether you're a peer, a clinician, or some other role, have to be mindful of that. And that's why it's so important that folks are doing their notes in a timely fashion. And so this is a practice to really support that with all of the other good things that comes with it. And so again, we want to make sure that what we're reporting in our documentation is accurate and reflective of the individual's perspectives and words, and we do that by getting our notes in a timely fashion.
Yvette, and I'm sorry to cut you off. There is a comment on the chat, Pam, regarding this. So, Pam, would you like to unmute and, or
Thank
would
you,
you rather?
Maria.
Sure, of
Yeah.
course. So there's a few things on the chat regarding the collaborative notes and how it works or it doesn't work for the providers because of the way that they work in the community.
Hmm.
Also questions about, being new and if this is a requirement or not. So.
Yeah. So how do folks feel comfortable with just unmuting themselves to clarify any of the questions that you had? I'm happy to entertain them here. I want to make sure you get them answered. Right. I do see a couple comments, and I think this will be on the slide coming up, which is like I find it difficult to take notes in real time while I'm with the peer. I completely get that. I think again, for some people, it takes a little while to process, and so that is just like it'll just be a strategy that you'll have to work towards. And when we get into the strategies, we'll talk about how you could do that incrementally. But I do understand that because I'm a person who likes to think, like I like to process it and then write it down. And that could be a little challenging in the moment. Yep. And says, yep, for clarity, I do the entire note with the peer. Yes, you can. Yes, you do the entire note with the peer. I'm not sure what your note structure looks like. I think that the practice of collaborative, like how do you get that note done and in the time that you're working with them, we'll talk about. And then Lisa says, can you sense work is out in the community? We talk about out in the community, cannot access the system. Yeah, Lisa. So we're going to talk a little bit about that. And okay. I just want to make sure I'm getting to all of these things.
There's one above those. Yvette from Stephanie.
Okay. So, yep, I see it now. So, if documentation's record is the only supposed to be what you would say directly to them, where do you document your subjective notes for other team members to see? That, Stephanie, thank you for that question. Because we get this question all the time. I think the reality here is that when you are documenting, so when you have a case record, right? There's like some people will say that there's like two types of notes, although personally, me, Yvette, would discourage providers from having two sets of notes unless there are very extenuating circumstances, which I'll talk about. But I think what we want folks to do is to, you know, if there's something that you need to write in the chart and you don't think that it's important enough to tell the family that you're writing in the chart or the individual, like for example, I might think that there's something going on with a particular individual. What we hope you do is talk with that individual about what you're seeing and what is concerning you, and then record that in the note. And I say that look at it from this perspective. As a person receiving services, at any time, they have the ability to request their record, right? So they could come in and they could say, I'd like to see my record. And if you are putting things in the record that you've never told them of or never informed them about, then that could be really a breach of trust, right? So I don't recommend we do that. I think if it's if you feel compelled enough to put it in the record, there should be some conversation with the individual about any concern that you have, right? And when we talk about documenting in the record, we're not talking about our judgments. We're not talking, right? We're talking about factuals. But if I had a concern about a particular person, I'm like, let's, for example, say I had a concern that someone was using substances, but I don't have any concrete evidence of that. But I do want to note the concern, right? I might say to the parent, hey, right? So I might say to the individual, hey, just want to check in. How are things going? You seem a little off, or something like that. I might say to them, I just want to check in because it's part of my role and just say they say, no, I'm not using any substances. I might then go back into the record and say, I would just document factually what I saw. So, individual was, arrived for the scheduled session. Individual was slurring their words. It appeared they may have been, drunk. I'm concerned about that, but I would put it in there in a way that doesn't affirm that that's what's happening, but it's just my observation of it. And then I'd go back to it in a future note. Perhaps the individual is on some new medication that day, and I find out later. I would clarify that in the note. Right. So I think so I think it's hard not to say like don't, put things in the record that you're not willing to talk to the individual about. If it's hey, I'm working, as in a team approach, and I just want to let my team member know that, I'm working with this individual. There's some concerns here. You would just verbally offer that up. But if you want to, but really, if, in the record, you should really be identifying those things that you're willing and able to talk to the individual about. And so, Stephanie, I hope I answered your question, but please feel free to unmute and provide any additional context that you feel would be helpful.
Yeah, thank you, Yvette. That was clarifying. I guess for me, like therapists have their own private notes. And I don't know, maybe doctors do too. But and legally, if subpoenaed to get those notes, they are not providing their personal notes. They are providing what's in the record. So, when doing family support work, I do use paper for my own observations, as you mentioned, for my own, because if I'm in a community where Wi-Fi is not great, or I just can't get connected, then the paper helps me. And then I always make the notes in the electronic record that same day. So I don't have that question of when did you do this? It's the subjectivity of my notes, some of my observations. I'm not saying, for using your example, I'm not saying someone is an alcoholic or that they need addiction treatment. I'm just saying these are things I observed. One time I actually wrote my concern that why are they in this program? And I couldn't believe it, but the person that took my place later told that person I said that. So there are certain things that I don't think belong in the record, but they need to be noted for the next person who comes up, taking over your spot. So I understand this whole idea of collaborative. It makes sense. And then there's this, I also feel like it's just Medicaid's way of saying we're not going to pay for your time to write a thorough note. We just want it all done. And that way it's, we don't have to pay so much. But I don't think that we always get the best note taking in an electronic record because we're forced to hurry up and do it with the client, with the participant. So anyway, yeah, thank you. That was helpful.
Yeah. Yeah, no, thank you for sharing that. I think that perspective is understandable. I think it really does differ in different states around whether people are keeping personal notes versus, because I do understand, and I've had people do that practice where the personal notes are really just um kind of memory aids for them, right? Like, because to your point, I'm out in the field and so I don't have access to an electronic health record, and so I'm just jotting down what happened so that when I go back to the office, I'm able to kind of translate those notes into an EHR. And so so some people do that. I do think though, if there are questions around concerns and things like that, like, again, you should talk with your agency about what are their guidelines around including that information. Like, I'll give an instance in New York, and this might be the same where you are, but so I do some clinical supervision in the field, and one of the things that we say in New York State is, like, when we have to do hotline calls for families, right? We want to document that there was a concern and that we made the call, but we don't want to bias the record by, because the call is not indicated at that moment. It is just a call of a concern. And so, we're told, like, you cannot put in the record I called, Child Protective Services, right? I can't say that because that kind of biases the record. And unless it's indicated, and then at that point I can do that because that's fair. And so, but you want to note that you had this concern, and it's, as a mandated reporter, you want the paper trail that you actually follow through with your professional responsibilities. And so, I think how we've settled it in documentation is just, clinician notified the appropriate authorities regarding this concern, right? And so, again, I say that to say, like, every state kind of manages that a little bit differently in terms of and state and agency, whatever your agency too, how much of that information that you want to put in. I will just say that, though, as a best practice standard, I would say it is best to make sure that you are inclusive of that information in the record, right? There's one extenuating circumstance that I would say is different, and here it is. Here's this one that keeps coming up every time. When you are dealing with child sexual abuse, that's where there's a little bit of difference there, because um, because that is like that really has some specific kind of protections around how they investigate it and how you don't kind of tip the family off to those things. And so that's kind of one of the areas where I'd say that probably requires some special considerations. But generally, most other things are pretty good to be put in, and we have to be mindful of our language because I think that's another important piece is to be mindful of our language in terms of how we put the concerns in there, right? If we're just delivering the facts, then that is what we're doing, right? We're delivering the facts. If we leave our judgments and speculations out of that, then it's easier to say to the individual or family, not coming from a family perspective. So I'm sorry if I keep going back there, but it's easy to say, like, yes, I recorded, the facts that when I came to the house, you were, you were slowing your words. And so yes, I did identify that in the note as a concern versus when that person was drunk, they were slurring their words, because I don't know that they were drunk. All I know is they were slurring their words. I didn't do a breathalyzer. I don't know that. So part of that is just really being able to have that conversation. And let me just take a moment to see if Maria has any comments around this, because I know Maria has worked in the field, and she's worked both with clinicians in a clinical setting as well as with family peer advocates. And so, Maria, feel free to chime in.
Yeah, no, I was just thinking that I'm gonna talk about this in a little while, so that's okay. But
Okay.
Joy has their hand up, so I am not sure if you had a comment or a question.
Well, I just had a comment about the documentation. It's just because I'm a peer support specialist, so I've been on both ends. Like I've had treatment, and then I've been doing this for over 15 years as a peer support, and I know the importance of documentation, and I understand like when you're doing a wellness recovery action plan or intake and stuff. But on the other hand, when I've had treatment, I had a psychiatrist that never looked at me the whole time. He was looking at his computer doing documentation, and I found it very uncomfortable. And I don't feel like you connect with the provider when the whole time they're typing on their computer. And like myself, I'm a two-finger typer. I would have to do the same thing if I'm sitting there taking notes the whole time.
Yeah.
So I think you lose something when you're sitting there typing the whole time on your computer and not engaging with not having a conversation with the person because you're taking notes.
Yeah.
But I've always like when I'm setting goals or they're giving me information, I've always read it back to them and say, is this what you meant? So I capture that like when I'm doing an intake or if we're goal setting or a wellness recovery action plan. But just if we're talking, that to me, I don't think necessarily needs to be in my notes because
Yeah.
we're bonding or we're, getting to know each other. We're building that rapport. I don't have to capture every little detail. I'm a paraprofessional, not a professional. I'm not, that's my opinion anyways, because I find it uncomfortable when literally my back is to my provider and we never have any eye contact.
Yeah. Joy, thank
Just
you.
a word of thought.
Yeah, no, thank you for that. And so that's important. And we're going to talk about that because, to your point, Joy, collaborative documentation does not mean that the person is documenting the entire time behind a computer screen while they're meeting with the individual. And we'll talk about that in practice. So more to come on that, but would agree. All right. So this slide is, again, as with any new practice, there are a number of concerns that come to the surface, and here are just a few valid concerns held by providers. And so we will keep these concerns in mind as we walk through some of the benefits of this practice. But again, as we talked about, we've heard people say like it takes away from services, that there's really no benefits to doing this, so why are we doing it? that there's no way to get this done. How do you do this? I can't do that. How do you, spend time to do that? And then again, as I mentioned before, someone, I need the time to think about what I want to write before I complete a note. And so we'll talk about how to navigate some of these challenges and barriers that have come up. And so, with that, I'm going to pass it over to my colleague Maria to walk us through this next part of the presentation, and then we'll go into strategies and I'll pick it up from there. So go ahead, Maria.
Thank you so much, Yvette. All right, so we're going to talk a little bit about the core values of peer support. And this is super important because of the work that we do. If you have any questions, feel free to chat them in or raise your hand, and this can be as interactive as you would like to. Next slide, please. So the goal of peer support services is to create a sense of community and belonging, reduce isolation, and provide a safe and non-judgmental space for individuals to connect and seek support from others who understand their experiences. So we understand that as peer providers, we are people with lived experience who are able to support, walk alongside people, our families, and be able to help them, gain whatever resources or whatever insight that they might need at the time. Um, Next, please. So that being said, part of the peer support core values is understanding that peer support is voluntary. It is a personal choice to have peer support, so it's not something that you can mandate to somebody, right? It is never forced, it's never required. And people actually do it because they want to engage and they find a benefit for their recovery journey, right? To get there. They find that to be something necessary for them. So not mandated. It doesn't work if it's mandated. Peer supporters are hopeful. We definitely carry that with us, that we have been through all these things through our lived experience, and we are able to show somebody what it looks like to continue that recovery process or to continue working towards finding more answers or educating ourselves or really understanding our children, depending on where we are and where we're working, right? uh Peers inspire, believe in positive change and a brighter future. That's what our story tells us. Even though sometimes we are also getting to that recovery, getting through that recovery journey, right? Ourselves, or that we're still handling certain things with with our children or with our family members. It gives a little bit more insight that things are possible and we're able to move on. um, Peer supporters are open-minded. We welcome perspectives and experiences without judging anybody. And that's the beauty of it. And I think when it comes to documentation, that is something that we can definitely put down on paper, right? We're not judging, we're not talking about anybody. We are helping the person tell their story through the way that we are writing it, right? We respect their journey, we honor their journey as somebody else that walked along our journey, supported us, and how, we're mindful of how we're telling that story, because we understand that if our story was told, we definitely want to be not always positive but always respectful, right? Even if there are ups and downs, and even if things are a little negative or whatever comes up, we want it to be respectful to our story and that there are words, right? Peer supporters are empathetic because we use our live experience and we understand. We're able to connect with people. We're able to connect with those families. We're able to use our compassion to be able to do the work that we do, right? We're not trying to change anybody. We're not trying to correct anybody. That is not the job that we do. We're literally walking alongside people to help them through their recovery or to help them get the help that they need at the moment. Next, please. Peer supporters are respectful. We honor the dignity, autonomy, culture, and values of others. We create safe spaces and respectful spaces where people are able to feel comfortable building those relationships, right? And that's the work that we do. And I heard some of that when you guys were making comments about that. Of course, when it comes to documentation, it sounds so clinical, right? Oh my gosh, I have to do this. But think about it as narrating somebody's story, like I said before. You're literally telling somebody's story through your eyes in a way, but also hearing and putting down on paper a little bit of what they're telling you. We facilitate change. We support other people in making their changes, whatever works for them, whatever they identify as something that they need to work on, not something that is ours. Even if we have walked the same path, it's not about us, and we understand that part, right? That's part of our core values. We're not leading, directing. We're not telling them what to do. And yeah, I've been there, so you should do A, B, and C. We're literally walking alongside them and being very respectful about their story. We're honest, we're direct, we communicate clearly, we're empathetic, respectful, and we trust uh, we work on the trust. While we work through relationship building, we are working to develop that trust, right, with other people, so they are able to tell us part of what's going on with them. And I think that's the beauty of being a peer. For me especially, I work with parents, and I feel like because I'm open about my story, they're able to feel comfortable telling me theirs. And I'm very humbled by that, because I hear so many things that I'm like, oh my gosh, maybe you never told anybody, and this is amazing. Now, how do I document this in a respectful way where I am not assessing, because I'm not a clinician. I am not overly judging anybody because, oh my gosh, how come she didn't do this if I was able to do this? Not at all. I keep my mind open to be able to continue to support. And they are where they are, and that's where, where I need to meet them. Peer supporters are mutual and reciprocal. So it is a two-way street, right? uh, we learn from each other, we grow together, and we benefit from those relationships and that relationship building for sure. Next, please. Sorry about that. Peer support is equally shared power. There is no hierarchy in peer support, none at all. And we know that, and we understand that. Even though it is very important to understand that we are placed in a position of power because we are working within these agencies, working alongside a multidisciplinary team. So it feels like there is a hierarchy, but that relationship building actually supports the fact that we are not, that we make it known that we are walking alongside individuals. um Peer support strength focus is focus on what's strong, not what's wrong. We uplift, we support skill building and any understanding, and you know we make sure that we see where people can get, but we are not pushing them to be there if they're not ready to be there. That is not the job. Peer support is transparent. We're clear about the role. And I think this is a very important thing. As a family peer advocate, I know we have a code of ethics, and I know that adult peer support and youth peer support, there it is a little bit of a little bit different, but it's very similar, right? What we're talking about, the core values. What are the boundaries? What are the intentions? What does the role entail? What can we do and what we cannot do? To be able to build that trust and understanding. I think this is huge because if we take and we get into the hierarchy piece, and we take our role to a place where we start mimicking the clinician's role, it becomes not a very trustworthy situation, and families stop feeling comfortable with it because now you're assessing. Now you're taking a different place, right? When we're not friends, we're not buddies. However, the work is that through my lived experience, I'm able to support you. And that's what peers go, right? And it's person driven. Individuals receiving support says the direction, their goals, choices, and values guide the process. That's for sure. It is intended for the person or for the family that we are working with. It's not about us. Next, please. Okay, and we're still emphasizing the core values and why we're doing this, because if we can literally keep this in the back of our mind at all times when we are providing the services, these are the things that we can actually help, that would actually help us write those notes differently, right? Strength-based approaches that promote hope. This perspective is woven throughout the whole process, the whole relationship building. The services are focused on identifying and building strengths and other important factors. A focus on hope is equally essential. The message that people can and do show resiliency in the face of adversity. So we're seeing people through a different lens completely, and we're also narrating their experiences through that same lens, and can recover from behavioral health conditions, right? And live a fulfilling life. We are proof of that. Um, Community inclusion, partnership, and collaboration. So the focus on this is on integrating the people, the individuals, and the families into their life or the communities, connecting them with supports, connecting them with hospitality, connecting them to services. Those individuals and families have to be able to feel like they belong somewhere, right? This is essential for them to be able to be able to sustain their wellness, to be able to feel like they belong, like they're part of that village, right? Person and family directed approaches. Services and support are individualized. They build with and around each person and family. So it is not a one size fits all approach. You are working with the family or with the individual that you're working with, and not necessarily because you had a similar experience as live experience, as I said before, or because you have other families that have gone through it, you don't necessarily can prescribe what it that is going to happen, right? Um, Multidisciplinary teams that include participants and family members reduce the fragmentation and ensure the delivery of comprehensive, effective services. So we are working all together. We're working as a team. We are sometimes the glue that keeps those teams um, mindful of what these families are going through or what these individuals are going through. And we are the ones that are able to speak on that to everybody else, right? And not pathologizing, not using any of that. It's like literally we're doing our work is very different. Family inclusion and leadership. Family members are actively engaged and involved at all levels of service process if it's appropriate, right? It depends on your agency, it depends on your situation, it depends on your program, but hopefully the family is able to, especially when it comes to children, right? Or youth, ideally majority of the programs will allow and will encourage the family members to be part of any policy development, any planning, any service delivery, or any evaluations that come up because we're working with minors. Peer culture support and leadership. Service systems and providers recognize the power of peer support and affirm that recognition. Person first culturally competent approaches. We are respectful of culture. highlighting that providers also possess an understanding of their own cultural worldview, the ways in which it enriches their work and the ways in which it may constrain their work. That being said, sometimes we have biases. Sometimes there's stereotypes that we heard growing up that we might believe. Sometimes we are biased against our own selves, right? We believe things about us that are not true, or about where we come from, our own people. We have to be mindful of those things. And I don't think that only applies to peers, but it's very important to do the work that we do. Also, that helps us not put that on paper when we're talking about families and when we're narrating their story. Trauma-informed approaches, all components of the service system are designed with an understanding of the role of serious adverse experiences and how this can show up in the lives of individuals and families. This will help people who we're walking alongside with to reduce the destructive effects of traumatic experiences and maximize the growth that can emerge from the healing process. This resource is from PeerTech. I will put the PeerTech was a program that was has a lot of resources that are available for you guys to use. Definitely CTech is also will provide you that information, but it will give you more perspective on that as well. Next, please. And if I'm going too fast, please do stop me if you have any questions or anything comes up while I'm talking, because I can't see all of you. Um, Holistic approaches towards care. These services are designed to enhance the development of the whole person. So we're working with the person as a whole, to be able to promote wellness, to be able to support that care. When we do this, we emphasize that we are addressing the person's primary needs and that we're integrating anything that is needed to be able to support that person, not just that one thing that we think is the problem, but the person as a whole, right? Holistically. Um, Care for the needs and safety of children and adolescents. There's a recognition of the incredible resilience of children and adolescents, especially when we're working with youth peer providers. We're working with youth in recovery. That's huge, but also when we're working with families, right? Because children don't exist in a bubble. They actually have families, they belong to a group. There's so much of that. Providers also recognize that attention to the safety, needs, and well-being of children and adolescents. I'm sorry, my cat. And well-being of children and adolescents includes attention to the safety, needs, and well-being of their families, and back up that recognition with concrete action. They're able to support that. Partnership and transparency. The system transformation effort is built upon the values of transparency and partnership at all levels of the system. Okay. Are there any questions, any comments, anything before I move on to strengthening peer values?
I I don't see any, but if any, I don't see any hands raised either.
Thank you.
Think
And
we're,
I'm so
yep.
sorry if I went so fast.
No, it's okay. I'll move to the next slide.
Thank you, Yvette. Okay, so now we're gonna talk about strengthening peer values and throughout the collaborative documentation, how does this align, right? What is the connection between one thing and the other? Next, please. So documentation is the bridge between intention and impact. So this is how we as providers, because we end up providing services to somebody, right? Get to support a person or a family we're walking alongside with to help them narrate their story. Again, if I view it through the lens of me narrating somebody's story or I see it as somebody's narrating my story, I'm going to be more mindful of what I'm writing down. So hopefully with their own, words here and there, whatever conversation you're having, you can quote whatever they're telling you. but we also have to be mindful of the language that we're using. The person-centered language is super important to be able to use. And we do have a lot of resources on that as well, because I know documentation is not the easiest, but it's something that we can be trained on. We have sentence starters. We have so many things that will support you into being able to write those persons with person-centered language in mind to be able to write those notes.
Yeah. And Maria, can I just jump in real quick
Of
to also
course.
just say from this slide, this perspective, you just heard Maria talk through the core values, and we're going to link how the core values relate to collaborative documentation. But the one point that I want to bring out is like there are so many fantastic things in terms of what the core peer values were that you like documentation is the one way that you kind of solidify, codify in the record all of the great work that you have been doing with the individuals with whom you're servicing and working with, right? And so coming from that practice, and you heard me say that earlier, from doing, from a peer provider doing this work, there's never, I never have the question as to whether or not the work is being done. It doesn't always get documented, which is the challenge. Um, but just wanting to give credit to just like when you are walking with someone down their journey and then you've seen them make so much progress that you want to capture that somewhere, right? You want to get credit for that somewhere. And I always say this, I didn't say this in the beginning, but I'll say it now because I think it's always important. When we're talking about documentation, generally people get overburdened because they think they have to get everything just right. Here's what I want to offer you. Poor documentation is better than no documentation, right? So if all you could do is write a couple things down, that timeliness, in terms of when you do it, then do it. Yes, if the grammatics are not right, you'll work on that as it comes. But poor documentation is better than no documentation. And so I just want to kind of say that because, again, as I mentioned before, the documentation is a skill that is learned. It is not inherent. You don't come with it. You have to learn it. But that's an important piece. And so, Maria, I'm sorry. I just wanted to kind of chime in on that.
No, that's okay. Thank you so much for that. So the strengthening peer values. There you go. We do this with respect. We respect the process. And we're demonstrating that we are respecting the person's voice, making sure that their story is told accurately and in their own terms, right? As we were saying before, sometimes we have to document things that are like not pleasant, but having that conversation with a person and saying, let's break it down a little bit more. And this is how I'm going to say this part, right? This is how I'm going to write it down. Do you have any comments on that? The importance of that is that the record is always going to be, the record is not yours. You're not carrying it, right? It's the person that is carrying it. And it could have an impact on their lives in general, on the services that they receive, on the services they don't receive, or how, it could impact how they see themselves if they ever request a record and there's something that is not, that is written through somebody that's assess something without doing it properly or just putting it through our own judgment or anything like that. Just let's be very mindful of that. Facilitating change, participants can see their own progress reflected in the notes, which helps reinforce strength and support their self-directed goals for change. Again, we emphasize this so much because it is about the person or the family that we're working with. And I think that sometimes as providers, we do, we get into the fixing mentality because it's so much, right? It's overwhelming. We have so many cases and it's like, oh my gosh, how can I move on with this and just be able to support this person? I know exactly what they need. But if they're not ready to do that, then we're not respecting their journey and what is it that they're gonna do, that they need to do. So they are picking their goals, they're doing the whole work for themselves, and then we're just walking alongside them. Honesty and directness, collaborative documentation, encourages clear and open communication, fostering trust and through transparency. So what comes to mind with this one is if I hold a separate note where I am assessing what I see, and this person cannot see that, I'm not being transparent with the person I'm working with. And now that becomes a problem because the relationship building is not going to be the same. I'm going to have it in the back of my head that I have a different, I'm viewing this person through a different lens and they don't know it because, maybe I have to. Maybe I need to say, I need to know what are those things that they need to change. But if I'm not able to have this conversation with them, then like how valid it is. How am I actually supporting this person? Is it valid to their life story? Is it valid to their services, to what they're getting? Or is it valid to me because I know how to fix this? Right. So being mindful of those things is super important. And it goes with our core values as well, right? Um, Mutuality and reciprocity. I'm so sorry. Both provider and participant contribute to the documentation process, reinforcing the idea that support is a shared and collaborative experience. It is not the easiest thing to do. I hear you on that, absolutely. But if we change our lens from we have to do documentation because it's this tedious thing that has to be done and whatnot, and we change the lens to, oh my gosh, we're telling this person's story. Like, how do I want my story to be told, right? Respectfully, let's talk about this. Let's build this relationship. Let's do this. And when things get really hard, like you do it with anybody else, like let's talk about this, because I'm feeling this way and something is coming up for me and there's a concern, there's a worry, but the relationship building part tells me I need to be able to tell you this, right? And then if we have to integrate anybody else from the multidisciplinary team to be able to support us, then we do that. But let's have this conversation and let's talk about how we can write this note together, right? How can we note it so it is respectful to what you're going through, but it also talks about what I'm seeing and like what my perception of this is. But if my perception is flawed, I would like to hear that as well, right? We're doing this in collaboration. Next, please. There is shared power. Oh, sorry. Okay. Shared power rather than being written about. Participants are given equal ownership over their records and care planning. And that's something that we have to keep in mind, right? Is their record and they're the ones that have access to this and that they're the ones that are the authors of what is in there, not us. We are just supporting them. Strength focus, participants help shape how their progress and abilities are described, promoting a positive strength-based narrative. It goes right back to everything I said, right? Making sure that we are mindful of our biases if we have any, and how is this being described by us when we are writing about this family or this person. Transparency, nothing is hidden. Participants see exactly what is recorded and why, which aligns directly with peer support emphasis on openness. It goes right back to our core values, right? We cannot hide that from them. And the reason why I think it's super important because it changes the dynamic between the person and the peer. If you are hiding something or you're seeing this person differently, it does change the whole dynamic between provider and the person that we're working with. And then it becomes a hierarchy and then it becomes something different that we really, peers don't work that way, right? So for us, no shame, no blame. There's sometimes that things trigger us. There's sometimes that it activates the worst parts of us because we've been there or because we're going through something similar. So in all fairness, we're all human beings, but the fact that we can go back and say, wait a minute, something is not happening the way that it's supposed to. I need to go back and reflect on this one. Use supervision to be able to talk about that as well, right? Person-driven documentation is guided by the participants' own words, goals, and values, just as peer support centers the individual's self-determined path. Use their words as much as possible if you are able to and if they're comfortable with that. Next, please. So these are the benefits of collaborative documentation. Increased transparency, promotes empowerment, enhances understanding, builds stronger relationships, encourages self-reflection, supports persons-driven care, reduces stigma and mistrust, validates lived experience. And a lot of these are literally self-explanatory, right? Because many of us have been in services and this makes so much sense, right? We want to make sure that that documentation is as we can put ourselves in their shoes, what we would like to see. Next, please. The benefit for the providers is that it gives the provider back the valuable time to do what they're trained to do. It helps to achieve a better work-life balance. You, you know, if you do this during the time and you take like the last 5 minutes to do this, you eventually get a hang of it. It's not like a 1, 2, 3, you're gonna be able to do it, but it does allow you to get into a system that you have where your notes will be done in a timely manner, right? And we won't forget anything. Everything is written down with the person. The record is more reflective of what occurred during the session or the time that you are with the person, improves documentation timeliness. I said that already. Other providers have the benefit of your documentation when they need it because people want to know the person that you have a very strong relationship with and that you're doing relationship building with, what is going on there? Sometimes they're not talking to their clinicians or the psychiatrist about some things. They're telling us those things, right? So how do we want that to be said? Protects from risk management issues, improves provider satisfaction. Next, please. And the benefit of collaborative documentation for the organizations is the improved documentation compliance because we have rules, because Medicaid is billable, the services are billable now. So we want to make sure that, you know, things are on time. There is nothing that is missing and that actually supports whatever audits that your agency might need. It is enhanced service quality and accuracy. This does capture more accurate detail, person-centered information, which makes sure that the care coordination is better, right? That this family, this person has exactly what they need because we are documenting things properly. Increased participation, engagement, and satisfaction. The people that are receiving services are feeling heard. They feel like they're involved. They feel like they are in the driver's seat to be able to talk about what is it that they need. And this will allow them to feel empowered, right? And nobody can take that away from them. They're able to get better because their journey is being narrated in a respectful and appropriate way. Supports person-centered and trauma-informed care. It aligns with industry best practices and values. This helps the agencies meet standards for culturally competent, recovery-oriented services. Also, greater efficiency and time saving, which is always a plus. Um, less time, less burnout for people. If you get used to it, the last 5, 7 minutes of the session or of the time that you're with the person, improve staff retention and morale. There's lower stress, um, job satisfaction. You don't feel like you're writing notes for the whole week, or that at the end of the month you have to write 50 notes because now you are late or you need to catch up. Consistency across documentation practices. It improves the clarity and the quality of the documentation across the agency. It doesn't have to be the same notes written, or it doesn't have to be prescriptive, but it does allow for things to be clear and to be respectful of the person. Demonstrate value to funders and regulators. It does reflect transparency, accountability, innovation, securing any funding that you might need for your agency and be able to maintain that accreditation. But remember, peer services are Medicaid billable, and Medicaid has the rules and the regulations. So organizations are able to keep up with that as well. Next, please. Give it right back to you, Yvette.
Yeah, thank you. Thank you, Maria. Thank you for walking us through the core values and just having that perspective on, I think, the importance of documentation and how how collaborative documentation aligns with the peer values. And so what we're going to do, spend the next few minutes doing, is just really talking about, well, what exactly is this practice? How do we get it done? How do we start? And so the first thing that I want to say here is that this practice really does require a shift in thinking and will challenge providers to communicate differently with participants. And for all the reasons we just talked about, right? We don't want to hide stuff that we're put in the record. Yes, it's sensitive, but we need to be able to talk with our participant about that sensitive information and how we're capturing that in the record, right? And so all of that is important. So it really will challenge you to think differently about how you are documenting your interactions with the folks that you're working with in their record, right? First and foremost, providers will need to believe in the practice and see it as essential. Um, because otherwise you won't be able to relay that to the individuals you're serving. You know, you'll need to be able to describe the importance of this practice to participants, relaying its value, and it's an interactive process. And as I mentioned before, this will be a new process for some. Maybe for some, they would have engaged in this process before, but probably for a good majority, it will be a new process and they may feel hesitant to participate. And so we may need to teach them what the expectations are and how they can contribute. And why we think it's important that they contribute. You know, if we say to them like, "Oh, we started a new practice. We just want you to contribute," they won't see the value in that. So that's why you really have to believe in the practice, understand it, see the value, and be able to relay that. You providers will need to be willing to leave some of the technical jargon and judgmental language behind. We talked about that. So, whenever possible, person-centered language and the use of the individual's own words when possible should be used. So, we'll set a routine that becomes a habit to do this, and you begin to build your skills. So, again, a little bit of a mind shift. Here are some of the things, though, as a new provider to this practice and approach that you will need to kind of do to set yourself up. So the first thing is that you need to be prepared to dedicate at least 6 to 8 weeks to try it out. And here, you know, I'd recommend that you try it with one person to begin with, right? Not all of the people that you're servicing. Like try it with one person, maybe two people, to just get a feel for it, right? Again, this takes practice. You have to remember to document objectively by only recording facts, again, leaving out speculation and judgments, right? So, because that could be a really a no-brainer for this process, right? So you have to remember to report factual observations. But in developing this practice, you also don't want to abandon your natural interaction style. You just want to incorporate more collaboration with your participants, right? So again, and I think I said this in the beginning, this doesn't change how you engage with folks, right? So you meet with them, you engage them, you get to know them, you develop that rapport with them. But you, again, just going to incorporate more collaboration. Uh, you will not always agree with the participant, but remember, it is okay to disagree. Your disagreement does not mean that you don't document their perspective, though, right? You may have a different perspective and you're okay to document that perspective, but you should also document their perspective, even when you are not in agreement with their perspective. So those are some of the ground rules. You want to allow and be open to the individual asking questions. Okay. So like, why are we doing this practice? Well, you should know why you're doing this practice. So again, all those things that we just talked about, how it supports the peer core values, you want to be able to articulate that to them. And so it's also a great opportunity for you to provide some psychoeducation and assist the participant in understanding the information that is noted in their chart. So like what type of information am I going to be asking you for? Well, I'm going to, I really want to get your perspective on how you think you're meeting your goal areas. I want to get your perspective on how you think we're working together. Like all of those things that you want to incorporate into the record. It's going to be important. And asking clarifying questions to make sure that you've captured the information correctly. And so that what I call that is really just a check-in. I always say, like, what I hear you saying is A, B, and C. Did I get that right? Did I miss anything? Do I need to, clarify anything? So those are things that you're just going to allow time for in this process. So just to reiterate, to be considered collaborative, the individual should, again, know what is being documented, ideally via visual access, so being able to see what is being documented, have the opportunity to ask any questions that they have about the process or any notes that you've put in there or anything that they're uncertain about, have the ability to ask those questions, have the opportunity to have disagreements and have their perspective documented. Again, right? We don't always agree, but if they have a perspective that is different from yours, that doesn't mean that it doesn't get included in the record. And have the ability to correct objective or factual errors. This happens sometimes when folks are, especially as you begin this collaborative documentation process, where sometimes things are in the record and then the individual tells you like, that's not correct, right? Maybe a data is wrong, maybe a service is wrong or something. So they have the ability to say, I'd like that corrected in the record. And so again, we should be able to correct that as long as we determine that we've made the factual error or just to the nature of that client, individual disagrees, individual states that blah, 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 it is this day and time, or it is this service. So we should be open to doing that, is my point. All right, so here are some of the considerations for setting up collaborative documentation. I mean, one of the first things you have to do is think about the technology that is needed to support implementation. And problem solve around potential connectivity issues. So we talked about this, I think, just a little while ago. If a lot of you are doing services out in the community, you're not always connected to Wi-Fi, not always connected to either your EHR. So how do you work around that? Those are things that need to talk through. You also need to identify the training needs. So what do providers need to know as they roll out this process? Again, so understanding how the values align with this process would be helpful, but what are some other things that they need to know? So those are things that you need to think through. What's the office setup? If you're doing services in the office, what's the office setup, or what's your setup when you're going into the community? Do computers or furniture need to be rearranged so that individuals can engage in this practice, right? So most of the times as providers, we're working behind the desks per se and behind the computer while the participant is sitting on the other side. Well, clearly, if that's the setup, you're going to have to figure out how it is that you can include them in the collaborative nature of documentation so that they can visually see. So that may mean that you pull a chair next to you and you tell them to come sit beside you, or that may mean you rearrange your office totally so that it's more conducive to doing this practice. All to say that those are things that need to be considered. Expectations for staff around the use of collaborative documentation will need to be considered. Again, I always think you start small and then gradually work up to doing this practice full time. And one of the things that has generally been helpful is really developing scripts so providers can know how they're going to introduce this concept to participants, especially participants who you may have been working with for some time. This again is going to be new to them. The other pieces, again, just thinking about the telehealth and the significant telehealth environment that we have currently, and just considering the agency's confidential and telehealth procedures. So these are things you would just do for normal telehealth, but you want to make sure that they have an internet connection. You want to confirm with the participant that they have a suitable private space to meet, right? You want to provide your welcome. If you do telehealth sessions, you want to kind of just start the session as you normally would. And then in the last 5 minutes of the session, you would also, just like I'm sharing my screen today, you'd bring up the documentation and share the documentation on screen and collaborate with the individual from a telehealth environment. That's how you can do collaborative documentation in the telehealth space. And again, and then you always should just have a backup plan in case technology fails, right? So something happens, internet goes down, how are you going to ensure that you've gotten their participation in the notes? So these are just all considerations and thinking about instituting this process. The same considerations apply when, again, practicing collaborative documentation in the community, but special attention should be given to technology needs, again, because we know that just Wi-Fi is not always available, or your electronic health format is not accessible to you in the community. And so you'll have to come up with a plan with how you're going to work around that while you're out in the field, and what the backup plan might be. You'll be looking at, again, whether providers have connectivity or a system that allows them to sync later. If not, what's the best options? If there's no connectivity, then you could, again, as we mentioned on the call, you could use a Word doc and then copy and paste when you're back online. It's not the most efficient, but it will work. You can use paper forms and then type later. And so just being mindful of that. Whether, meeting with participants in the office or community, you just want to ensure that individuals are not able to view the protected health information of others. So you just want to make sure that you're keeping that in mind. Also, as providers begin to implement this practice, it will be important for these skills to be strengthened during supervision. So for those supervisors on the call as well, just really thinking will be important for you guys to kind of come together and problem solve and think through some of the potential challenges, but also in identifying expectations for beginning and implementing this process. So one of the things that we always like to share is really just developing a script. So when developing a script, you want to consider including the following elements to gain buy-in into the process, right? So this is the script that you would inform participants of the expectations around this new practice, or that you're going to be rolling out this new practice. You want to highlight that their feedback and opinions are important, and you want to make sure that you capture their feedback correctly. You want to explain that you'd like to ensure you're providing them with the best service possible, again, and adhering to all of the peer values. Remember that this will be a novel to most participants. And again, you'll have to provide guidance as to how they can participate, and be clear about the expectations. And so we'd love to include examples of a sample script that you might say when you're working with, these are new participants or participants who have not been working with you previously. So we might say, as we're here, believe there's some value in making sure that you contribute. and to what's written about you and your and recorded about you in your sessions. I also want to make sure that what I write is correct and that we both understand what's important about our sessions. So at the end of the session, we'll be able to work together to write a summary of the important things that we discuss. So it's very, again, very simple script, nothing too detailed, but you really want to just let them know what the expectations are. For existing participants, there's a little bit of a different script again because they have been working with you. So this will be really foreign if you, since you have not been doing this in the past. So you just want to let them know that you'll be making this shift, right? And that you want, again, same thing. We now believe there's value in making sure that you contribute to what's written in the notes. I want to make sure that what I write about you is correct and that we both understand what's important about our sessions. So from now on to the end of the session, we'll work together to write a summary of the important things that we discuss. And so that's base. And so here are just some actual phrases that you can use as you begin to put this into practice, right? So, I write notes about our sessions, and today I'd like to have you help me with that. I'd like to get your feedback. Okay, let's sum up what we've discussed today. So these are just all actual phrases that you can use to really solicit their collaboration at the end. I'm not sure if a lot of folks on the call work with children and families. Maybe you do. And so know that this practice can be inclusive of children. I actually oversaw a children's behavioral health clinic where I instituted collaborative documentation and we were doing it with children. And so, there's many different approaches that people took. Children are pretty good at this. Actually, they love it. Sometimes what we would do is we'd give the child like a pen and pad, and they would, we'd have a little conversation at the end about, what they learned, what they wanted to tell their parents they learned. Obviously asking them in ways that they understand. So, sometimes you can say like, what will you tell your mom about what we did today? Or what will you tell your parents about what we did today? And they could verbalize that piece and including that. So if you're working with children, just know that this is a practice that can be done with them. And here are some examples on the slide around how you can solicit their feedback. And so just thinking about how do you get this off the ground? Like what do I do first? Like just find a starting point. Like I said, pick at least like one section of your progress note that you can complete with a participant. And just start small. Not everything all at once, right? And I know I saw a comment in the chat that said like depending on how your EHR is structured, it may either enhance or make it difficult for you to engage in collaborative documentation. But those are all things that, again, as you're thinking about doing this practice that you want to take a look at. But listen, just pick one section of them. You don't even have to do the entire progress note. Just pick one section of that. Use that as the starting point for the following session. And then as you get more comfortable doing it, then you increase the amount done over time. And then again, just to remember that the documents are really used as clinical support tools to be utilized in service provision. So I say that to say it's not intended to be written and never looked at again. These should be living documents. So, but start small. Don't try to tackle everything at once. Use descriptive language of what is discussed. Again, we talked a lot about that, right? Focus on behaviors rather than labels and judgments. Like that you can leave alone. Highlight a participant's strength, right? And then you could use note writing prompts for easy discussion. I know when in New York State, when it comes to Medicaid billable progress notes, there's a couple areas that they want you to touch upon, and it's usually around like, what was the intervention? What was the participant's response to the intervention? What's the plan? Like it's those things. So you can just for easy, you can use those prompts to kind of really help you ask the individual questions around things that you want to include in their note. So that will be helpful. And then here's the key. So I know we talked earlier where people thought like collaborative documentation is like someone behind the computer screen talking to you for and taking notes while you're doing the session. And I want to say that's not what we're talking about here. Collaborative documentation, if you look at this little graph, really, it is really, you take either the last 5 or 10 minutes at the end of the session to really summarize the work that you've done in that session, right? And then that is the time in which you are collaboratively working with that individual to complete the note, right? So the other time in the session, you are doing again what you normally do, engaging as you normally engage, talking with them. You know, if you make kind of notes to jog your memory, that's it. And then at the end, you come together and say, oh my God, that was such a great session. Let's sum up what we did today. What goals did we work on today? You know, what did we do for that goals? What do you want to do next? Like that's how that works. It is not the whole entire session where you're documenting. And so if you can start setting aside those little few minutes, of course, probably in the beginning, you need to set aside probably a little 15 minutes because you got to kind of work yourself up to doing the practice more efficiently. You'd be amazed about how much clarity you get in terms of the work that you're doing with people and how much of that they understand and don't understand. So it's a great tool to like make sure that you guys are on the same page. Like oh, you thought we were working on this goal today. Like let's talk about what we did and let's talk about how that relates to that goal. Or like that wasn't my understanding, participants saying like I'm not walking away with that. So it's very helpful in the moment to really help the service provision as you are working with the individual. So that's important. So again, last few minutes of the session. Couple of things. There are situations where collaborative documentation is not appropriate. Okay. That's 93% of the time, though, it is, and it's positive and it's helpful. So generally, when people don't implement collaborative documentation, it's because they're focusing on that small 7%. I'm going to tell you to focus on the 93%, right? There are times, so crisis, right? When people are in crisis and things that collaborative documentation may not be the time to do that with them. But for the majority of time, you can practice this skill with them. So just to sum up, give yourself a goal. All right. So again, start small. Take a section of a note that you're going to actively solicit the feedback. Write a script so that you can tell participants what you're going to be doing and that they're not like taken off guard. So those are little things that you can do. Develop and practice your script, right? So that's helpful. Identify and explore areas of resistance and the reasons behind this resistance. And so that's your personal resistance, right? So tell me, like, think about why you would not want to do this practice. Knowing all of the benefits to all involved, tell me why you wouldn't do this and spend some time exploring that again, because I did say it requires a mind shift. You have to have some buy-in. You have to believe in the process to be able to sell it. Pull up the notes. The individual can see your document because that's again part of the collaborative documentation process, and use the documentation really to empower participant interaction. All right, so I just would encourage you all to really try it out. I think again, benefits to the participant is that they feel heard. As Maria has stated, they're able to narrate their story. Their story is in the record. They don't feel like they're hiding things. Transparency, open-mindedness, trust, all of that, all great stuff. On the provider, though, you're done with your note, right? Your work-life balance is good. You're not sinking in paperwork. It doesn't require you do it right then. It's more accurate. You're capturing all of the things in the client's voice and you're building trust. And so those are all great. And then all those things translate into great things for the organizations, of course. But realistically, I think the highest benefit comes in working with the participant and doing this practice. And so that's important. And so that is collaborative documentation. Of course, we have time for questions. So I want to check my time. We have 10 minutes for questions. And so what questions do you guys have? Any questions?
I think I have a quick question.
Sure.
And I heard Maria kind of touch on this a little bit, and I wrote down even some of the examples she said is we need to be able to discuss this, but I guess I'm just some of the hesitation might be around when it comes to documenting their struggles or challenges, particularly with peers that have emotional setbacks or might be more emotionally reactive, things of that sort. And so I guess I'm just wondering any sort of further advice. It's not often, like I love the perspective of we are going to focus on the positive, but at the same time for transparency. And I know you also mentioned it's okay for us to notate their perspective, even if it's different from ours. So is that
Yeah.
something I would verbalize when we're collaborating? Like, okay, it's your perspective today. You didn't have an anxiety or angry attack. I'm going to go ahead and notate it's my perspective. We should still improve on that.
Yeah, so that's a great question. And I
Does that
think
make
this is,
sense?
yeah, no, that makes complete sense. So I think it's a great question because oftentimes I think what happens is, sometimes people are just hesitant about not wanting to offend those you're working with. And so like they have a hard time saying like things were not great today, right? And again, the, people are very resilient, but we do have to, I think, especially from a Medicaid billable perspective, they're they're receiving a service because there's some challenge or difficulty that they're trying to mitigate and work through. And I think what we could say it's okay if you were struggling today with anger. I'm going to use that just because you say like today you had an angry outburst and that is a goal that we are working on. And I can see that you're putting a lot of effort into working on that goal. However, today was not a good day for you, right? And so it wasn't a good day for you because you would describe objectively what happened. But what I'd hope is that you can have that conversation with the person. And then when you're writing the note, right? When you're writing that note, like, okay, let's talk about what happened today. So you came in, you're very angry, you called me a couple of bad names, but you were able to, you know, turn it around. But and we were able to get through the session. But I'm going to document that you were struggling at the beginning of the session. And they would say, well, no, they may say, no, that's not, I don't think so. I wasn't angry. They may give another emotion. This person ticked me off, so I came in here in not a good mood. And so then I'd say, okay, so let's talk about that. So, you know, individual notes that, upon arriving, they were, I don't know, instigated. I would, say something. I put their perspective in there and I'd say, but during the session that appeared by like, an angry outburst or something like that. So I would really, when you get in the habit of just describing things factually, it actually becomes easier to relay to the person that you're working with because it's just more like transcribing what you see. Um, and most of the time, because it's descriptive and behavioral in nature, they don't really say, no, that's not what happened. They may clarify like why or the content around that, but they usually don't say like, I wasn't screaming if they were screaming, honestly.
Yes,
Is that helpful?
that's helpful. It definitely helps. Yeah, that definitely helps. Yeah, of course, we want to definitely steer away from any sort of position of going in a back and forth and just, yeah, it's a very sensitive, as you said, gradually learned process. But I wrote that all down, and that is super helpful. It helps answer my question. So
Yeah,
thank you.
no problem. And I think, just too, when we're talking about the challenges that people have, I know we talk about language and Maria talked about this, it's like we want to be respectful, right? So we just have to make sure that when we're talking to folks around the challenges that are sensitive subjects, that we are also in tune with our language around how we're framing that, how we're approaching that with them, so that they don't feel attacked or judged, because that's kind of the reaction that you get, right? When people feel like you're judging them or you're attacking them or some other thing. So yes, I'm gonna stop sharing for a second. Just okay, so I can see folks. But yes. Other questions? I mean, I know it's a lot of information. And again, want to just recommend that if you hadn't seen the our other presentation that we did that talks more about like how do you document what's included in a note, like it will help kind of bridge some of what we said here today as well.
And you can get watch the recording of that session off of the Empower Idaho website.
I'm also adding a link for documentation done right part, which is the peer information, and we did that before. So you have a lot of resources in there that we work on for peers. It definitely is a lot of like good info that you can incorporate and maybe get more support. I think supervision is an amazing place to
Yeah,
be able to get that support from your supervisor and talk a little bit more about what the documentation looks like for you.
absolutely. And also just to say, like, if you have not done collaborative documentation, it really, I know when you're first hearing about it or first learning about it, it really kind of seems like a foreign concept. And so like sometimes you have to sit with it. And I just want to say, like, from my previous experience, actually, when I ran a behavioral health clinic, I had 13 clinicians who I was rolling out collaborative documentation with because they were not the greatest in terms of timeliness and it was causing some audit issues. And so it took 6 to 10 months, I want to say, for everyone to kind of get on board. All of them, some took to it very quickly, some it took a little more time, but all of them consistently after the transition was like, I can't believe I did not do this before. Like it, again, in all different timelines, right? But because it saved them, first of all, they just felt they were able to establish rapport, they were getting their documents done, like it was leading to good conversation with whom they were working with, but they were also done with their notes at the time of session. And then, as you guys know, in outpatient clinics, they're seeing people back to back to back to back. So even if they go a whole day and try to write their notes at the end of the day, they're already, it's already too much because they've seen 5 or 6 or 7 people ahead of them. And so they just did not understand how they hadn't adopted the process beforehand, although the road there was painful for them. I will say that. It took a minute. So I just say that to say there's a lot of information that we threw out to you, but just think about it. And again, start small if you can and see how it works for you.
Thank you so much, Yvette and Maria. Another wonderful presentation with an incredible amount of information. I will be sending you an email within the next half hour, actually, with the survey link and the links from the session. The survey is in the link to it is in the chat, so you can click on it and get that taken care of now. With all that information, you might need to use your slides as a cheat sheet. You can look for the full CEU requirements in the confirmation or reminder email. And you've got until Monday at 4 to finish your survey. I suggest you do it sooner than later. It's kind of like documentation. You retain more the sooner you do it. And the slides and recording will be available on the website next week. Give us a couple of days. And thank you everybody for attending. And it was pretty cool to see that pretty much everyone stayed through the entire presentation. So I hope you really take something wonderful for your practice for this. Thanks again, Maria and Yvette.
Thank you. And thank you guys. Great bunch.
Bye, everybody.
Bye
Have a
bye.
great rest of your day.
You as well.
Okay.
I'll be in touch with you, Maria and